Not to be dramatic, but oxygen is quite literally the breath of life. Ever feel like you're gasping for air or running out of breath for no apparent reason? Low oxygen levels in your blood could be the culprit, and it's not something you should ignore. Oxygen-rich blood is vital for producing energy, maintaining the function of our cells, and keeping our organs working smoothly. On the contrary, when blood oxygen levels drop, whether due to an underlying health condition or high altitudes, the body struggles to get the oxygen it needs to generate energy and maintain normal function. In this video, we're revealing the top 10 warning signs of low oxygen levels in your blood. From subtle symptoms you might brush off to more serious red flags, we're breaking down what to watch for so you can stay ahead of any potential issues. So if you're curious about how to keep your oxygen levels in check and what signals your body might be sending you, stick around. We're about to dive into some vital info that could make a big difference in your health. Now, without any further ado, let's get to it. Number 10. Shortness of breath. One of the telltale signs of low oxygen levels is feeling breathless or like you can't catch your breath, even with mild exertion or at rest. This occurs because your body is trying to take in more oxygen to compensate for low levels in the blood. Low oxygen levels in the blood is known as hypoxemia. In 2017, a study published in the New England Journal of Medicine explored the link between hypoxemia and shortness of breath in patients with chronic obstructive pulmonary disease. The researchers found that shortness of breath was strongly correlated with lower oxygen levels, where 85% of patients with oxygen saturation levels below 88% reported significant shortness of breath. Number 9. Rapid breathing. If you find yourself breathing abnormally fast, it could be your body trying to tell you that you are low on oxygen. What happens is that the brain senses low oxygen levels and signals the lungs to breathe faster to compensate. This is the body's natural response to low oxygen, as it tries to increase oxygen intake by breathing more frequently. A 2015 study published in the Lancet Respiratory Medicine examined the respiratory rates of patients with lung infection or pneumonia and their correlation with blood oxygen levels. The study involved 300 patients diagnosed with pneumonia, where researchers recorded respiratory rates and oxygen saturation levels over the course of their hospitalization. The study showed that 78% of patients with oxygen saturation below 90% had a respiratory rate above 20 breaths per minute. This is above the normal breathing rate, which is between 12 to 18 breaths per minute. Number 8. Bluish skin, lips, or fingernails. A bluish tint to the skin, lips, or fingernails is an alarming sign that indicates that your blood isn't carrying enough oxygen. Oxygen is carried in your blood by a molecule called hemoglobin found in your red blood cells. When hemoglobin isn't oxygenated, it acquires a darker color which appears blue under your skin. An observational study published in the American Journal of Emergency Medicine in 2019 examined the presence of bluish discoloration in patients with acute respiratory distress syndrome. The study found that 60% of patients with oxygen saturation levels below 85% were presented with bluish discoloration in their body. Number 7. Confusion or cognitive impairment. Confusion or cognitive impairment is described as difficulty thinking clearly or a sense of disorientation. It is important to clarify that the brain is highly sensitive to oxygen levels. So, when it is deprived of oxygen, it can't function properly, leading to symptoms like memory loss, difficulty concentrating, or confusion. 150 patients with obstructive sleep apnea were gathered in 2018 and had their cognitive functions assessed using the mini mental state examination. This was before and after they were treated with continuous positive airway pressure, where a positive pressure of air is introduced via a mask into the airway. Such treatment increases the levels of oxygen in the lungs. According to the results, 70% of patients with oxygen saturation levels below 85% at night had cognitive impairment, with an average mini mental state examination score reduction of 15% compared to normal levels. Additionally, cognitive function improved by 20% on average after 3 months of continuous positive airway pressure therapy. Number 6. Headache. Persistent and severe headaches, especially those that worsen with activity, can be a symptom of low oxygen levels. This occurs because low oxygen levels cause blood vessels in the brain to dilate. As these blood vessels widen, the blood pressure inside them rises, resulting in headaches. A study published in Cephalalgia in 2017 followed 120 individuals living at altitudes above 3,500 meters. Among the steps taken in the study was monitoring their oxygen saturation and headache frequency over 6 months. The results showed that 80% of participants with oxygen saturation levels below 88% reported frequent headaches. The study found a direct correlation between low oxygen levels and the occurrence of headaches. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Vision problems. Sudden blurring of vision or having trouble focusing on surrounding objects can be scary. Unfortunately, this can be an indication the eyes are deprived of adequate oxygen. Similar to the brain, the eyes are sensitive to changes in oxygen levels, and low oxygen can affect vision by reducing the amount of oxygen supplied to the retina. The retina is the tissue in your eyes which sends electrical signals to your brain about what your eyes see. 150 patients suffering from retinal diseases due to diabetes were assessed for vision changes and oxygen saturation levels. Retinal diseases due to diabetes are termed diabetic retinopathy and occur due to a decrease in the blood reaching the retina secondary due to diabetes. A consequence of a lower blood supply is also a lower oxygen supply. According to the results, 60% of patients with oxygen saturation below 90% reported blurred vision or difficulty focusing. These results were published in 2018. Number 4. Dizziness or lightheadedness. Feeling faint, dizzy, or lightheaded can occur when the brain isn't getting enough oxygen. As we mentioned earlier, the brain requires a constant supply of oxygen to function. Low levels can lead to dizziness or even fainting as the brain struggles to operate with limited oxygen. A 2018 study published in Circulation examined the incidence of dizziness in patients with heart failure and its relation to hypoxemia. 200 heart failure patients participated in this study. As indicated by the results, 65% of patients with oxygen saturation below 90% reported dizziness. The study found a significant relationship between low oxygen levels and dizziness. Number 3. Fatigue. Persistent and unexplained tiredness or exhaustion can be a sign that your body isn't getting enough oxygen. Without enough oxygen, cells cannot produce energy efficiently since oxygen is vital for getting energy from the food eaten. As a result, a general feeling of fatigue and weakness takes over the body. In a study that involved 180 patients with interstitial lung disease, the prevalence of fatigue among hypoxic patients was estimated. It was revealed that 75% of patients with oxygen saturation below 89% reported significant fatigue. Number 2. Rapid heart rate. You may experience a faster than normal heart rate as the body tries to deliver more oxygen to tissues. This is because when oxygen levels are low, the heart pumps faster to circulate oxygenated blood more quickly. A study published in the Journal of Applied Physiology in 2015 investigated the effect of hypoxia on heart rate in patients undergoing high-altitude training. To gather data, 100 athletes were monitored for heart rate and oxygen saturation during a 3-week training period at high altitude, above 3,000 meters. The study found that 85% of participants with oxygen saturation levels below 88% had a resting heart rate increase of more than 20% compared to sea level conditions. Number 1. Chest pain. Having sharp, stabbing, or persistent chest pain is a sign that your oxygen levels are too low and are severely affecting your heart. This can be a sign of serious heart-related issues, including a heart attack. Just like any muscle in your body, your heart requires oxygen to function properly. So when oxygen levels are low, your heart muscle can get strained, leading to chest pain or discomfort. If we take a look in the Journal of the American College of Cardiology in 2016, we will find that a study was published which investigated the link between hypoxemia and chest pain in patients with angina. After monitoring 250 patients, it was found that 55% of patients with oxygen saturation below 90% experienced chest pain during periods of physical exertion. So, these were the top 10 warning signs of low oxygen levels in your blood. These symptoms can vary in severity depending on how low the oxygen levels are and how long they've been low. When experiencing any of these symptoms, especially in combination, it's important to seek medical attention promptly, as hypoxemia can lead to serious complications if not addressed. Now, we want to hear from you. Have you ever experienced any of these symptoms before? What was the cause? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.